response line. Email us or connect with us on social media. This is Rogers TV, Grey County.
You're invited to join us on the couch, first Tuesday of the month for the 5th anniversary season of your loved local LGBTQ talk show.
September 20th, 2007.
January the 9th, 2003.
December 14th, 2013.
On August the 13th, 2009, Dr. Ian McGilvray and his team saved my life.
Too many people die every year waiting for an organ donation. Please, let's eliminate the wait list.
As an organ donor, you can save up to 8 lives and enhance the lives of 75 others. Pledge a gift to life. You'll be glad you did.
This is Rogers TV.
Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and before I welcome our guests today, for those of you who watch the program regularly, you know that I like to take a few minutes to say thank you at the beginning of the program. So today I'm going to be reading from an author, Alison Wines, excerpts of a letter that she had distributed, and this letter was sent to me by Francesca Dobbin, who is the Executive Director of United Way, Bruce and Gray. So I'm going to just read some excerpts and then just add a few comments at the end. There is an invisible group of people who aren't being recognized, who are working intensely to keep the world turning, to make sure that those on the front lines have the support they need, and those at home have something to go back to when we get to the other side. Who are you? You're the HR teams working 80-hour weeks to begin workforce planning from scratch, redeploying team members, trying to think of something, anything, to preserve jobs. You're the CEOs of charities writing new budgets so you can keep helping the world with funding that has evaporated overnight. You're accountants and bankers restructuring finances and debt to help small businesses stay afloat. You're trade managers negotiating frantically to get hand sanitizer and face masks into the country. You're consultants supporting clients through massive change, unsure if you'll get paid for what you do, but you're doing it anyway because it matters. You're hospital administrators running payroll for the nurse that just clocked 30 hours of overtime. You're communicators trying to find the words to explain a crisis the likes of which has never been seen to your organization's staff and to the community. My words to you are this: you are not invisible. And our message is your contributions are greatly appreciated. We send to you a most heartfelt and sincere thank you for what you are doing. And on that note, I also want to thank my guests today who are joining me. We have Warden Paul McQueen from Grey County and also Rob Hatten from Grey County. And I'm wondering if both of you would mind describing your roles a little bit. I know today we're going to be talking about Grey County's role in this emergency. So I'm very interested in knowing, because Grey County is basically where everything seems to come together. So first, who'd like to go first? You guys.
You do the honors, Warden.
Well, thank you very much for having me on today. And I think, as I sort of spoke before, as the warden of Grey County, is no different than a mayor of a municipality. I'm sort of the chair of the meetings, but I'm also the spokesperson, and I speak politically and to the public with regard to what's going on. And with great help of Rob, he keeps me well informed and keeps me on the straight and narrow. So that's always important. And but it's also important to have the ability to educate and communicate to the general public, along with staff and other municipalities, along with yourself. And so we try to do that job as well as we can. And also, I guess, as the warden, I'm the signatory as for the corporation, so I sign all the important documents. So I'll leave it at that.
And over to you.
Thanks, Carol. I guess I'll start with what my main role is at the county. I'm the communications manager. And to really summarize, my job is helping the public understand what it is that Grey County is doing, communicating the decisions that are coming out of council, and trying to keep people informed. Sometimes I like to think that my job is basically being a translator. Because there's a lot of unfamiliar language and complicated material that comes through. But in the case that brings me on the call today is I am the emergency information officer as well for Grey County's emergency control group.
Yeah. So I know that pre-COVID, there has been an emergency preparedness plan in place. And I'm wondering if you'd mind talking a little bit about that, and then how that's changed and where we are now in COVID-19 situation.
Maybe I'll let Rob go first, and then I'll follow up from the high level.
Sure. Yeah, I'll let you guys toss it back and forth. I'll just sit back here and watch the play.
Sure. So Grey County has a rather robust emergency management program. It is something that we're mandated to ensure we think of through our emergency management program. When you look at our plan, we're prepared for a lot of different things, but it's typically the blizzards and ice storms, tornadoes, chemical, public, particularly because a lot of the decisions in a pandemic are coming from the top down. They're really influenced by the federal and provincial governments as well. Obviously, public health has a huge role to play in advising on the emergency as well. Our emergency management plan, if you were to see the printed version of it, if I prop my laptop up, it would probably raise it above my head. Warden McQueen can attest to that. It's very detailed, and it breaks down specific roles and responsibilities for all of the various Grey County departments, as well as roles and responsibilities for some of the stakeholders that we would work with, whether it be utilities, local municipalities, social services partners like the United Way or Red Cross. And it really is there to make sure that we can react very quickly when an emergency happens. And did you have anything to add, Paul, to that?
Well, I'm going to say, as far as the warden, part of my duty is through the working group of all the representation around the table during or leading up to an emergency. It's up to me to declare that emergency from the advice of everyone around that table. And they always say, when in doubt, declare. This one was a little different because it wasn't like my experience. I've dealt with a tornado. I've dealt with a big fire that happened in Chapman's Ice Cream in Markdale locally. Those they come to mind that I've been part of. But this one is sort of just like a winter storm that's gone on for a couple of months, and it's a little different. But then, because we were meeting quite regularly, and then we started to ratchet it back to 1 day a week and that type of thing. Because this is I would say, uncharted territories to what we're normally used to. And the other example of an emergency could be the ice storm that happened back in '98. Eastern Ontario, where there was that situation that went on, and a lot of people were out of hydro. And those are the type of things that we train for. We train for ice storms or power outages or that type of thing where, you have people that, especially if it's in the winter time when it's a colder time and people need warming centers and stuff. And it's also important where you have generators where your working group can meet and also be able to communicate information out and a number of things. So you can never be perfectly prepared, but more training is better than, and I may go back to Rob, but generally we try to have an exercise once a year or that not only includes the county, but also includes the lower tier, because as an example, back in, trying to think what year, early 2010, 12, where a tornado came through Durham and then went through Grey Highlands and also part of Blue Mountains. That was an emergency that affected more than, I think it's 2 municipalities, which then also triggered the county involvement on that. And also when it gets into a lower and upper tier, generally your representative from that municipality will sit on the county's emergency control group, along with the mayor or deputy mayor would sit on the lower municipalities control group, because sometimes when you have a larger, there's 2 different control groups going on to synchronize their discussions and making sure that they're working together. Because sometimes it's equipment, sometimes, like for example, with Chapman's Fire, we were quite lucky that we were able to use some of the fire equipment from Owen Sound. They had a ladder truck, and so we all work together on trying to solve it as best we can. Or with the COVID-19, it's sort of like I said, it's just like this winter storm that's gone on for months. Hope that helps.
So from the communication perspective, has this been different in how you communicate to people? And we always learn lessons as we go through. What are we learning through this that's different than the emergency situations that have actually occurred previously?
I think there's some similarities and certainly some differences in the way that we're delivering our messages. Fundamentally, the principles are the same, is that we want to communicate clearly, we want to communicate accurately, and we want to communicate timely. That's always important in an emergency, is that we're giving people the information that they need so that they can make good decisions and do the things that they need to do. Yeah. So in this emergency, our messaging is very much aligned with public health and what they're doing. So we've been very closely contacting Dr. Era and Drew Ferguson, the communications lead at Public Health, to make sure that we're helping push out their messages, because they are the experts in this situation. We're not epidemiologists at the county, so we certainly do rely on their expertise. We're using some of the same channels to push the messaging. Fortunately, technology has made some leaps and bounds in recent years that's been very, very helpful to us. We're very reliant on social media for pushing our messages out. So there's some tactics that we can use to kind of target our posts geographically so that we're pushing them to our residents. But we still rely very, very heavily on our relationships that we've developed with local media and working with our experienced reporters to help get the important facts out to the people. Because if you look on social media, on a Sun-Times article or any Rogers TV posts, you'll see that people are following this emergency closely. So it's certainly of interest to people, and we want to work with all of our partners to get this information out.
From your perspective, and I know, so you have a specific tab or page specific to COVID-19, correct? In the county. I did look. From your perspective, and I know the county has different programs meeting a variety of needs, is there something different about the needs that are being identified in the COVID-19 that the county is encountering?
I guess I could probably start, and you, as Carol, probably more specifically to Owen Sound, it's the need of those in need. I think at our county council last week, I think OSHA? Mm-hmm. 11,000 meals or lunches or whatever. That's just unheard of. I mean, it's amazing that they were able to do that. And so the food banks and those that are of need, and I, the province, through the federal government, was able to move money forward to all those different individual groups of need. And fortunately, and thank goodness, and thanks to the provincial government for doing that, or the upper tier governments for doing that, because it's kept that little bit of an ease, along with, I know, the assistance that the federal government has provided. Saying, there's lots of conversation that say it's not perfect, but in this situation, it's sure good that they're doing that to help ease the people, in the sense, because whether you don't either have food or you don't have money to buy food, there's a number of programs that are working out for that. So that's great. And one other thing I wanted to add, Carol, is unique to this situation is it's not only a county declaration, it's not only a lower tier declaration, but it's also a provincial declaration, which is, I don't know if there's ever been a time when that's ever happened, Rob. I don't know. It doesn't come to mind, and something to that level. And so it's so important, and we see it now that we're starting to unwind the spring, so to speak, of now, because we all ramped up to COVID-19 and everybody was in self-isolation and, non-essential travel and all that stuff. We're starting to unwind the ball of yarn, or whatever you want to say. We get the communication from the province, and it changes daily along with the federal government. And then you got to deal with, Rob's department and through us at the county to move that out. We never, for example, we never closed the rail trail where other areas did. And, you get mixed communication, and then we have a conservation authority that has sites that people love to visit. And so there's that part of, and then you have the lower tiers that are doing their thing. And, and what we're finding coming out of, starting to unwind this is we get an announcement from the province, but then the lower tiers, whether it's boat launches or other things, have to take time to get things in play. And, and the general public say, hey, it's open. The boat launch is open. Why isn't it working? And well, we just got word 2 days ago but you got volunteers, you got other people that run those things, and then you got to keep the distancing from people lining up. And, there's a frustration level, but because everybody's been cooped up. So, it's a different situation, but we know what, Carol, we're Canadians, we'll work through it, and we'll be patient, right? And that's what we need, lots of patience.
I certainly can understand the challenges for those in communication, Rob, for sure. And as we move forward with things being open, we're all not quite sure whether the message is going to be on a go forward or go forward and back a little. So how will that impact you? And, what strategies? And so that's one question. And the other question that I would ask Paul is, you mentioned that there are meetings. Now it's once a week. So after Rob has a chance to tell me about communication strategy, if you can say who sits, or I don't even know if you come and sit at the same table, you may not, who participates in the meetings where the information then gets shared with Rob and through others. So Rob, how do you cope with the quick messaging that you have to do, or just unsure consistently what is the message?
It definitely is a challenge, and it's been one that we've been facing throughout the emergency, especially in the early stages where things were changing literally by the hour. And I think the best thing that we can do is try to push people to the best sources of accurate information and try to get that out front, because as we all know and as we all see, there's certainly a lot of misinformation that floats around out there, especially on the internet, and you don't want any of that to take legs. We have a lot of really reputable media outlets around here, and we want to push people to the sources of the truth and regularly. And certainly we've been taking out advertisements. We've been working with public health to push messages out. And if we do get into a situation where we're phasing in and, as you said, taking some steps forward and then perhaps regressing back, it's going to be very, very challenging for people to follow. So we're just going to keep pushing people to resources like grey.ca, our website, for the source of truth, is what I will call it, in all of the noise that's out there. And
that's a good expression, actually. I really like that, because people need to go to reputable information sources, because social media has advantages but disadvantages for sure.
Mm-hmm.
Warden McQueen?
So while you were talking there, I was writing down, trying to remember all the people that are around that meeting, because a lot of it's either on Teams or you're on the phone or whatever. So Rob, help me out here if I miss somebody. But to start off with, our CAO, Kim Wingrove, she sort of chairs that meeting, and generally it's about an hour long most times. We have a slot for an hour, and then myself is the warden, and then we have Penny Colton, who is our assistant, that keeps both myself and the CAO sort of aligned in what we're with meetings and that, and she takes the roll call and she does the minutes. And then we have Rob here, who's our communication director, and he reports on what's been communicated and what he's going to be needed to be communicated. We have I'm trying to think, it's not a director, but our CEMC person, Rob. She's not called a director. What is she?
She's the Community Emergency Management Coordinator. So ours is Marlene McClevy at Grey County, and she's the one that plans all of the exercises and makes sure that we have our plan in place for when these situations happen. She's very integral to it.
Right, coordinator. That's the key. Coordinator. She coordinates us all. We have the Director of Long-Term Care, Jenna Cornell. She reports on our long-term care homes. Housing is Barb. I always get them mixed up. Barb Fetty and Barb Fetty is our housing, or is it social
services director, and Anne Marie Shaw is our director of housing. Yes.
Yeah. I always sometimes get those mixed up, because that's a very important role for us at the county, because a good part of our staffing, I think, is it over 500 employees, Rob, for social services and housing, of the 800 some employees that we employ.
And long-term care as well, yes.
And long-term care, yes.
Yeah.
So that's a big chunk of our employment or employment right there. So we have Pat Hoy, it's from transportation, and then we have from protection is Jennifer Ormsby. She's the interim detachment commander, and she reports from OPP. And then from fire, it just escapes me his name. I hear his voice. He's from Owen Sound Fire, I think, Rob, isn't it? The individual that reports for fire. Is it Wayne?
Is that Jeff?
Jeff, yes.
Yes.
Jeff.
Yeah.
Yes.
Yeah.
Jeff. And that's who I have. Who am I missing? Rob, who am I missing?
I think that you're covering it very well, Paul, the members at the table. And I'd just like to speak to the social services and housing a little bit more, because that's kind of, it's a good way to highlight the root of what we're doing. And it's making sure that everyone has access to the essential services that we need. And a lot of that is delivered through our social services programs, and one of those being under the umbrella affordable housing. Mm-hmm. So that's working with our partners and agencies. Paul mentioned earlier the social services relief funding that we received. So that's something that comes up regularly as updates on how we're keeping the vulnerable people in our community cared for.
And I'm wondering if you would, either of you would be comfortable. There are concerns. I mean, we do have homeless people, and the concerns around making sure these people are safe, especially in COVID-19. Now, I know the county has been working very hard to help these individuals, and I'm wondering if you would mind talking a little bit, because that's part of an emergency plan, right? To keep people housed and safe.
I can maybe start. I know at the very beginning of this COVID-19, we were trying to keep the Grey County office open, because not everybody has e-transfer, so people have to pick up checks or whatever. And I know they tried to keep that as open as long as we could, and try to follow up. Because I heard one time in a stat earlier on this year, there's 1 million Canadians that don't even have a bank account. So it's very important to have the access to those those opportunities for checks or however to move forward. So I know we stayed open as long as we could for that. Maybe, Rob, you have more information of how we continue that, because those are the front line people that have very unique needs that need it, like today, right? Yeah. So maybe, Rob, you can speak to that maybe a little further.
Yeah, that was one of our biggest concerns back in March when we were closing the facility, is how can we connect with these very vulnerable people that are hard to get a hold of. And we have managed to do that. And beyond that, we've been working with partners at the Canadian Mental Health Association, OSHARE, other organizations through the community where there's a lot of overlap with these people, to make sure that we're not losing sight of them, that we're understanding what their needs are. We have to be very careful right now because we know that COVID-19 transfers from person to person. So anywhere where there's going to be a congregate setting, that's a dangerous situation for the people who are there. So we're fortunate that we've been able to work with local motels and set up some arrangements where we can give people temporary accommodation, especially if they have symptoms and they need to be self-isolating or they've had a positive test. We're able to give them those places where they can safely recover.
And I think that's definitely reaching out into the community and meeting the needs of people right where they are. Mm-hmm. So I'm sure as you're going forward, there are lessons you're learning along the way. Is there a plan for a debrief whenever we get through this?
Absolutely, there will be. Yeah, go ahead, Paul.
Well, I was going to say, maybe I don't want to compare this to this situation, but I know after the ice storm in 1998, there was many years of examining what they could have done differently at that. I think the tornado that hit Godreach, I know there was a lot of conversations around, because every situation is sort of like a test situation where you try to learn by what was right, what was wrong, how would you do differently. I know when the tornado hit Markdale, I think there were 60 recommendations that came out of a report that was, that was back in 2009. So we always try to do better. And certainly with COVID-19, I think we're going to be talking about this for a few years, but we're all going to probably get tired of talking about it, and we're going to look for something different to talk about, right? But it's going to be a case study, and I mean you look at media in itself, and some of the stories they chase maybe isn't in the best interest of the general public, but it's a story, and we have to be able to, and maybe Rob can speak that more, is it's the big news story, but is that really what makes it right? So maybe Rob can continue on that.
So we have about a minute left, Rob. So
yeah, well, I think with some of the big takeaways that I've seen on the communication side is the tools that are available that I think are really going to boost our public engagement processes for the long run. One example would be the virtual town hall meetings or updates that we're doing through long-term care for all of the families who are unfortunately unable to get in to see their loved ones. So we're doing about every other week, we're doing some updates with the director of long-term care, and we've had public health on there a few times to answer the questions and concerns that they have. And as well, this can work into other areas of our business as we're looking to move planning activities and public meetings forward using these types of platforms so they're more accessible.
Perfect timing, great communication. I want to thank you both for being on the program to talk about Grey County and the emergency plan that's in place. Thank you for joining me, and thank you to the viewing audience for joining us today. Please take care, stay safe, and care for each other. Thank you.